So you will start with the is there any feedback you need to give from the last meeting? Recollection, or we dive straight into the presentation?
Okay, so what we did was that I'm trying to project, let me share, even though it won't be the normal, how do you call it, schedule that we normally follow, like sharing the membership updates and the rest, but there are a few, especially the previous minutes, the highlight, those key things, but very short, 2 minutes, 3 minutes,
okay,
and then
so why don't we do that?
So we can have ample time for,
why don't we do that at the end of the presentation, if you like? If that's the case, I'll welcome everybody, and then we can do it. Hopefully by that time, everybody will be here. Because I think initially you probably won't have.
That is fine. Yeah, it all works.
Yes, so that those who are here on time at least can benefit from the presentation, because it's been advertised for other branches globally as well. Yes, just in case people come in, they don't really want to know about our in-house meetings. Yeah.
Very well.
Okay, so I'll reclaim the host, and then you can look out to let people in unless they're coming in directly.
Okay.
Okay.
So
look out for joiners who are in the waiting room, and you let them in.
Okay. Yes, I realize you've also come as a host.
Yes.
Okay.
Does that still work for you?
So since the agreement was that.
So you would host and then I'll present. Is that right?
Yes.
Okay.
Yes.
Let me see whether I can change anything. 1 second.
Yeah.
You can simply press reclaim host.
Reclaim host, okay.
Yeah, you've got it.
Okay, yes.
Okay, let me try and share as well.
Okay.
Let me know when you can see my screen, all the slides. Can you see the screen, the slides?
Yes, please.
You can, okay.
It has come now.
Okay, I'll go out and back in just to make sure we have the sound as well. Ruji, welcome.
Thank you, Mr. Poku.
How are you doing? It's been a long time.
Yeah. I'm doing great.
Good,
Thanks for
good,
asking.
good.
Grass, you're also doing well.
Yes, by His grace, always good.
We thank God. We thank God.
Mr. Maxwell, you're welcome. Hello, Maxwell. Mr. Maxwell, you're welcome. Hello, Maxwell.
Yes, please. I'm here. Thank you very much.
Okay, good evening, everybody. It's just turned 7:30. So what I will do is just quickly introduce the IRSM Ghana branch to you guys. I'm sure most of you are on our WhatsApp platform as well. And just extend a very warm welcome to you all. So this evening, we're going to talk about prostate cancer and prostate enlargement. Now, it is not from a directly medical perspective, that is more of an awareness. We felt there was a need to spread that awareness amongst our Ghanaian folks, as well as those joining us from afar. And I'm a bit surprised. I guess I'm not surprised that our females haven't joined us today because they feel the subject does not concern them, but it does in a way because they may have a father, brother, boyfriend, or a friend who might be suffering from this sort of illness, and they'll be able to spread the awareness on. And I'm hoping that at least we'll get a few females join us as we kick off. Bernard, is it okay to make a start now? We've got 5. I'm sure the numbers will swell as we start. You don't have anybody in the waiting room?
Not yet. I'll create your indulgence that we can give them some 5 minutes and see. Additional
We can
5
give
minutes.
okay, an additional 5 minutes. That's fine.
Yeah, yeah.
Okay, maybe you can just tell us briefly what our last session was whilst we're waiting that 5 minutes, and what we seek to do as a group.
Very well. Vice please, can you see my screen?
Yes, I can.
Oh, okay. I hope others can also see the screen.
It seems to be opening your agenda. I'm not sure it is opened yet.
Yeah. Is it okay now?
The agenda hasn't opened up. It's still opening.
It's still opening.
Yeah.
Oh.
I'm assuming that others are seeing it in the same way.
Yes, exactly.
Yes, please.
Has it come fully?
No, not yet.
Goodness me.
Don't worry, just briefly
Very well.
tell us, what did we do last month? What did we cover? And
okay.
You can close your screen and just talk.
Okay. So, good evening, everyone. So last month, October, we had our webinar on the topic emergency preparedness at the workplace. So, fortunately, I was the presenter, and so within 3 minutes, I'll just highlight the key points. So, first of all, we look at why do we need emergency preparedness at the workplace? And the answer is simple, because it can happen at any time, like fires, chemical spills, and natural disasters. So we need to be prepared. And we also look at the legal requirements of our occupational safety and health in Ghana from the perspective of the 1992 Constitution, Article 3610, Clause 10, and then also the Factories, Offices, and Shops Act, Section 52 to 53. Then finally, the Labor Act itself, the Act 651, Section 118 and 119. They all talks about how safe the worker should be, and the requirement of the employer to have a safe environment. So emergency preparedness is also a key area to keep the workers safe. So we look at types of workplace emergency. So we look at fire, outbreak, chemical or biological violence, power equipment failure, and the rest. Then we look at emergency preparedness plan. You need to have a plan in place for this unforeseeable event. And then the response as well. How do you respond? Emergency response plan. You need to have such things. Then the worker responsibility. We thought it is all about the management, top management level, who have to provide emergency preparedness, the plans and everything. But you as a worker, you have the responsibility. I.e., if you see a fire in this village at a workstation, you need to report to the appropriate authority. But if you baptize and say, "Oh no, that's not my concern," it will spread up, and then you yourself you'll be a victim of such. Then again, we look at evacuation procedures. That's also another key area. In case it happens, how do you evacuate people to count for every single life? The use of fire extinguisher based on specific needs. So there are types of fires or chemical, whatever disaster happened, and then sometimes we are not aware of the type of extinguisher. We thought it is one stop shop that if it's a fire, you can use either foam or water or the dry powder one. There are specific, emergencies that may happen. I.e., fire, the type of fire, then you can use the specific extinguisher. Then lastly, we look at what you should have in your emergency checklist. What you should have in your emergency checklist. So there are a number of things that you need to have. When the emergency preparedness officer, or let me say, in this case, the health and safety officer or manager is separate from the emergency controller. Yes. So when an auditor comes to check whether that company or that premises has complied fully, what are the things that you need to put in place on the checklist to qualify? So basically, that's what we look at.
Okay. Thank you very much. Okay, I think it's
see the time?
7:38 now, so we can start. Yes, can you all see my slides?
Yes, please.
Yes,
Okay,
please.
so once again, very welcome to you all. So we're going to talk about prostate health and well-being. So when we talk about prostate health and well-being, we're talking about anything that creates that discomfort for the men folk in particular. This is something that affects men directly, and women may be indirectly affected because of the emotional support or physical support that they may need to give or provide to a loved one or a relative who is suffering from this. So my name, for those of you who don't know me, is George. I'm the Managing Director for GEP Safety Consultants, and I'm also the Vice Chair for the IIRSM Ghana branch. So we'll just make a start. So these are the key objectives for tonight. We want to find out what this prostate gland is, where it's located in the body, and its function, what health issues it presents. Now, who is affected most and why? What the main causes of prostate problems are, how to detect if we have a prostate problem and when to get early treatment, and how we can maintain good prostate health. And also the burning question often is, can we recover from prostate problems? So we'll try and answer all of these as the presentation goes. As I said earlier, this is not a directly medical explanation, but it is an awareness session. So the prostate itself is a walnut shaped gland that is located between the bladder and the back of the anus. So it's literally around there, that area. I don't know what age group we have today, but there are times where those who are suffering from this may feel pain somewhere in between that region. And that's probably very likely to do with the prostate gland. So that it surrounds two important things: the urethra, which carries out, which helps us to urinate, and therefore any enlargement of the prostate gland can block the urethra. There will be a video which will explain this in some more detail. And it also aids semen flow within the body. So it has these two main functions: the production of seminal fluid and also facilitates ejaculation. So later, as you find that some of the symptoms of men who have prostate enlargement or prostate problems may include what we call dysfunction of the male organ in some ways. It also regulates urine flow. So if you remember when you were a child, you could urinate and it literally comes out like a what we call a projectile following an arch formed with a very strong stream. You would find that as you grow older, your urine tends to come straighter, and then to the stage where you get to your 70s, 80s, and then it's reduced to dribbles. And again, that is a symptom of prostate enlargement as we grow old. It also provides what we call regulation of the hormonal fluids in our body. The hormone that tends to be affected most is the testosterone levels and androgens. And these contain enzymes which normally convert the testosterone to something called DHT. And that DHT is crucial development for male characteristics of the prostate health. So sometimes you'd find that when your DHT levels increase, that's when you tend to experience these prostate problems. And that comes with the aging process. So therefore, most of the treatments that you may find that you're being given will seek to reduce testosterone levels and DHT levels in the body. I will come to that in detail later. So an enlarged prostate or benign prostatic hyperplasia, they normally refer to it as BPH, is that common condition, and that affects 50% of all men aged between 50, 60 and upwards, and then 70% of men over 70. And they say that almost 90% of men over 85 will most likely experience BPH. So it's something that we'll all expect at some point as we age. Studies also show that those from the Afro-Caribbean and Sub-Saharan African men face elevated risk of prostate cancer. Now, there's two things. There's prostate enlargement and prostate cancer. And we'll explain those later and find out the reasons why those of us from the Sub-Saharan African nations and the Afro-Caribbean sectors tend to have that elevated risk of prostate cancer. We'll talk about those and look at some statistics relating to that. So these are the statistics that show the incidence, and it takes it at the rate of 100,000 per group. So the yellow sections here show the incidence, which is quite high, which means quite a lot of Black men tend to get prostate enlargement compared to the whites, Pacific Islanders, American Indians, etc., etc., which is a strange phenomenon. And then looking at mortality as well, again, the tables appear to be stacked against the blacks for reasons which we'll try and explain as the presentation goes on. Now, these statistics have been repeated again and again and again, and they will yield the same results. Now, let's look at Ghana on the globe and the type of statistics that we have. Now, this statistics here looks at all types of cancers that perhaps hit us, both male and female. And the top 3 cancer incidents in Ghana include the liver, the prostate, and general health issues. And in women, we have breast, cervix, and the ovary being the most prevalent. Both sexes, of course, breast, liver, and cervix topping the charts. And then mortality-wise, again, prostate is one of the top 3 that kill men, whereas the cervical cancer and breast cancer tend to kill our lady folks. So we can see here that even in Ghana, when we take the top 3 cancer incidents and mortality incidents, prostate cancer is amongst the tops there. Now, why do Black men suffer disproportionately? Again, it boils down to our social norms. I'm sure most of you will attest to the fact that when a Black man or a Ghanaian or an African has any problem down below, it is something that they are often ashamed of and don't want to mention it, and therefore do not tend to seek medical advice until it's very, very late. And they often feel that if there's anything not working down there, that is due to their promiscuity or something that they've done. Whereas this is a normal phenomenon. We tend to be shy. We can go to the GP and sit and mention headaches and other things that the GP will often have to probe and say, is there anything else bothering you? And then incidentally, they'll say, oh, well, I tend to be urinating quite frequently, or as the Ghanaian would say, my thing doesn't work. These are the sort of excuses that we tend to have amongst our group. So for 70% of us, we're more likely to develop the cancer because we don't treat the symptoms early. So research attributes the following reasons: that also there is a lack of early access to medical advice. If you take a poor villager who realizes that his urine processes have been interrupted, they tend to just go for herbal medication. They won't be seeking medical advice until it gets worse and worse and gets to this point where they actually have urine retention. At that stage, the prostate would have enlarged significantly to the point where traditional or even orthodox medication may not work, and therefore they may have to go in for surgery. Now, an enlarged prostate may also mean that your prostate is enlarged because you have prostate cancer. And if it's at that stage, a very late stage diagnosis, then the mortality or survival is lower because you've left that condition too late. Now, why do we do this? Again, it's because of a lack of awareness and fear of the unknown. People often fear what they don't know and do not want to discuss it until it's too late. And this is something, again, very common amongst Blacks. The heavy reliance on the local traditional remedies and the ease of over the access counter unprescribed medication in Africa and most of the third world areas, again, is part of the issue. Rather than going to seek advice from a doctor or a medical practitioner who can diagnose the exact condition that they're suffering from, the easily accessible drugs are obtained, which may not be treating the underlying problem, but rather the symptom, and therefore leaves the problem itself untreated till very late. Now, when people go to see the doctors about urinary flow diseases or anything relating to the prostate, they tend to have what we call a digital examination. A digital examination is where the doctor inserts a finger up the backside or the back passage and tries to feel around for the prostate. And in doing so, they're trying to feel whether it is smooth and homogeneous. In that sense, there are no unexpected lumps or hard areas. Lumps or hard areas may suggest that there is some abnormal growth or tissue being developed in the prostate. Now, the fact that a Ghanaian man will go for a fellow man to stick his finger up the back passage itself is deemed a stigma. Some don't want to do it, and some don't even want to talk about it. So again, this contributes to the high incidence. And I must admit, the same also affects our Indian and Asian brothers as well. They tend not to want to subject themselves to this sort of examination until, of course, it becomes very late. Some of us might have a family history of similar conditions, and they will generally accept it as part of the normal aging process because an uncle or a father or an auntie, not necessarily an auntie, but someone they know may have suffered a similar condition as they aged, and therefore they will all assume that this is normal and part of the aging process. So these are some of the reasons, albeit not entirely scientific, but that's what we can establish. So let's look at the prostate issue itself. So there are two main health issues that face the male population. I mentioned BPH earlier, and our BPH itself is simply the enlargement. It's benign, which means it's not cancerous, and it tends to be what we call a prostatic obstruction because it tends to simply obstruct the flow of urine and competes with the bladder for space. Therefore, those who suffer will also experience that feeling that each time they go to the bathroom, their bladder is not entirely empty, and they keep going because the bladder itself has been affected in terms of space and volume because of the prostate enlarged gland pushing into the bladder. So BPH will just cause the prostate to grow, and that causes the blockage of the urethra. So at some point, a man will feel that they want to go to the toilet, but when they go, nothing will come because at that point, the urethra has been blocked. And the only way you can actually discharge is to go to a hospital and have a catheter inserted. So it's useful that we pick up the signals early and not wait to that stage, because at that stage, intervention can be painful, uncomfortable, and perhaps sometimes difficult to live with. The other major condition that can cause problems with the prostate is prostate cancer. And again, an enlarged prostate can be a sign of cancer, which has its own risk factors. And that includes, obviously, aging issues, family history. So if a family member has had cancer of the prostate, there is a likelihood that you can have it. So it's good to start screening early so you can rule out and perhaps treat a condition before it becomes a problem. The third possible condition that we might have is something called prostatitis, which is where you simply have an inflammation of the prostate gland. That inflammation may come out as a result of overexertion. People who ride bicycles a lot can sometimes have inflammation because of the trauma, particularly in Ghana or places where your roads have a lot of potholes. Constantly hitting against the prostate area can cause some form of inflammation as well, or it could be a simple infection that causes that. So these are the three main conditions. But it's important to note that when we say someone has got BPH, that person has not necessarily got prostate cancer. So don't fear the term or diagnosis enlarged prostate. The only time you have to worry about it is where you've done your PSA test and the PSA test is elevated. And again, we'll talk about the PSA in a moment as well. And the PSA will be explained. But otherwise, it's totally benign. It just causes so much inconvenience, and we just need to make sure we identify and treat it as early as possible. Okay, so what are the causes? We say aging, we've talked about that, and then hormonal changes, where we grow at certain rates. And the next video that I'm going to show will take us through those changes where the gland grows from one size to the other. And these are pivotal stages in our life, such as puberty or indeed adolescence as we grow. And of course, if you have a lifestyle where you are obese, you don't exercise, then again, that leaves you susceptible to all sorts of diseases, which include prostate enlargement. If you've got diabetes or heart diseases, then again, studies show that these conditions may raise the risk of a prostate enlargement or prostate cancer as well. Lack of exercise. Please, let's at least try and do 30 minutes vigorous exercise every day if we can. If you can do more than that, all the better. It's always good to keep the circulation going and remain healthy. That will ward away or ward off a lot of health conditions that we suffer today. Okay, I hope you're all with me so far. So I'm going to just play this video quickly. Let me know if you can't hear it. I hope you all do, which will just give you a quick graphical overview of the gland and how it grows from time to time. Just ignore the ad. You'll get there.
Grammarly now uses AI to help you write, not just revise. Type a prompt and generate a persuasive, mistake-free draft in seconds. Personalized.
Boy, I will love you to the...
Let me start it again. Hopefully we'll go straight to the video rather than this prolonged ad.
Ten years ago, it all began with one trade. Discipline became my edge.
When you gotta go, you gotta go. But imagine racing to the bathroom and not being able to empty your bladder. If you're living with benign prostatic hyperplasia, BPH, you just might know what it's like. In short, BPH means you have an enlarged prostate gland.
Sorry,
But
can you all hear the sound?
Yeah, we
Yes,
can
I
hear the
can
sound.
Okay.
To fully understand it,
but
let's
we
take a
cannot
closer
see the
look at how the
screen.
prostate grows. Composed of
Yes.
glandular
So the
and
screen is
muscular
not
tissue
showing rather.
racing to the bathroom.
Sorry, you can't see the screen.
Yes, the
Exactly.
video.
The video is not showing. Okay, let me try
Yes.
it again. Technology always does that. Okay, please let me know if the video is not coming up. There will be some ads and then hopefully. Can you see the ads though?
When you gotta go, you gotta go.
No, please.
You can't see the video either.
Yes, please. We can't see the video.
That is very strange. Okay. That's a shame. Let me try one more time. Let's move the window. Let's see.
But imagine racing to the bathroom and not being able to.
I'll try one more time. If it doesn't, I'll send you the link. Share options. Sound.
Okay.
Okay. Can you see the video now?
Okay, so yeah,
You can see the
Yes,
video.
yes.
Okay.
So we can play now. Yeah.
Gotta go. But imagine racing to the bathroom and not being able to empty your bladder. If you're living with benign prostatic hyperplasia, BPH, you just might know what it's like. In short, BPH means you have an enlarged prostate gland. But to fully understand it, let's take a closer look at how the prostate grows. Composed of glandular and muscular tissue, the prostate goes through two main stages of growth. It first grows during puberty and doubles in size. The second growth stage happens around 25 and continues for most of a person's life. BPH usually occurs later in the second growth stage, between the ages of 50 and 60. The prostate gland surrounds part of the urethra, the tube that carries urine and sperm out of the body. When it's enlarged, it's harder for bodily fluids to pass through the urethra, which is why common symptoms of BPH include trouble peeing, including a slow or dribbling stream or difficulty getting started, peeing frequently, feeling like you always need to go or needing to pee during the night, urine that's a different color or smells funny. Milder symptoms don't always need to be treated, but your healthcare provider will watch for any changes to make sure things don't get worse. However, more severe symptoms may require medications that can slow prostate growth or relax its muscles, surgical or minimally invasive treatment to widen the urethra or remove any tissue that is blocking it. And be sure to contact your healthcare provider immediately if you're noticing stomach or genital pain while urinating, pain, fever, or chills while urinating, blood in your urine, or not being able to pee at all. The cause of BPH is not well understood, but some researchers believe aging's effect on the testicles might lead to it. As the most common prostate problem, almost all men will experience enlargement as they grow older. 50% of men will show some signs of BPH by the age of 60. 90% of men will have symptoms of it by 85. Half of them will need to seek treatment. So, does having BPH mean you're going to get prostate cancer? The short answer, no. But since BPH and prostate cancer have similar symptoms, it's possible to live with both at the same time. If you notice any changes, ignoring what's going on won't make things better. Neither will getting advice from friends on social media. Talk to your healthcare provider. They can review your family medical history, examine you for BPH, or suggest a prostate cancer screening if need be. BPH is quite common, so if you're living with it, you're not alone. Reach out to your doctor today to prevent further complications down the road.
Okay, I'm glad we managed to see that video in the end because I felt it was quite informative. I didn't want to not show it at any stage. So we'll go back to the presentation, which has now disappeared from my screen, but we'll find it. Okay, can you see my screen now? Can you see my screen?
No, please.
No,
Not
please.
yet. Bernard, do I still have control, or do you have control as host?
In sharing, no?
Yeah.
Yes, please.
Do I still have co-host? Because it's not
Yes,
allowing me to share.
Oh, chose multiple participants can share simultaneously. So if first it was only one person as you are sharing, but in case you are finding difficulty.
Let me see what. Excuse me, guys. Do bear with me, please.
Okay.
I'll try
All
and
right.
get this resolved. Okay. Let me try something. I will leave and then come back. Maybe it just needs resetting from my side.
Okay.
I can see a chat. Someone may have a suggestion. Okay.
Okay. Yes, you are back now.
I'm back on. Okay.
Yeah. Yeah.
Okay. So after that video, I hope we all have a good idea of where the prostate is located and really how it enlarges through the various stages of life. So let's dwell a bit more into the symptoms, because that's what I guess we need to be more mindful of. So any pain in your penis or testicles or perineum, which is pronounced parunia. The perineum area is that area between the testicles and rectum that I showed you at the beginning. And again, if you have a frequent urge to go to the toilet, and each time you go, only a small drop or a tiny volume of pee comes through, but you still have that urge to go, then again, that is a typical symptom. Pain while you're weeing or ejaculating, again, is a symptom. Slowness, dribbling, and a weak stream is also suggestive that you may have something wrong with your prostate gland. There are times where people travel or sit for a long period of time, particularly if you're on an STC and you've stopped somewhere and suddenly you're given 15 minutes to go to the bathroom, and you go there, and if you just pay attention and look at the older men, the younger chaps will come in, and as soon as they unzip, off they go. They're peeing all right. The men, older men, tend to stay for a while. It takes time for the urine to start flowing. And again, this is all due to prostate enlargement. And when I say older ones, with prostate enlargement, it can start right from the age 40 onwards, and sometimes a little bit sooner. So we are all exposed to that sort of problem. And in the worst case scenario, you have what we call the urine retention that I mentioned, where the urine doesn't come at all. And immediately you need to be going to the hospital to have a medical intervention, which could be a simple catheter through there to open up and allow the urine to flow. The frequent need to get up at night to pee, again, is also a symptom. And this is where it gets tricky for most of our Ghanaian and Africans. Erectile dysfunction also comes with enlarged prostate. So people might be going to the pharmacies or the counter to pick up medication for erectile dysfunction, taking Viagra and all sorts of things because they feel they can't perform, whereas the actual problem itself is masked. They're not treating that. And this is one of the reasons why in Blacks and ethnic minorities, this disease is able to go unabated for a long time. In most European countries, you cannot buy Viagra or any of these sexually enhanced medication over the counter. It needs to be prescribed by a doctor. But we have free access to it. So we tend to bypass the doctors and treat the wrong thing. Now, blood in the urine or semen, again, might be suggestive of prostate problems. Now, sometimes pain in the lower back, the hip, or even the chest, which is strange, may again suggest that there is something wrong. And in those cases, it tends to be more of the prostate cancer rather than just a simple prostate enlargement. Okay, so what can be done? The common checks that we need to be doing. My advice to everybody aged 40 and above is to start doing annual checks or annual screening. And usually you'll go and see your doctor. And again, it's that very not so discomforting, but uncomfortable digital or rectal examination, where they simply insert their finger in a glove into the back passage to feel around the prostate to see whether there's anything untowards growing over there. Now, if they don't feel anything and there is slight enlargement, they might ask you to go and do a PSA test. In any event, I would advise every man to start doing PSA test, which is the so-called prostate-specific antigen blood test. That is a test that gives you an indication as to whether you have prostate cancer or not. The normal range for the PSA is from 0 to 4, and some laboratories will use a different threshold, which is 0 to 3. So if your PSA sits within 0 to 4, then it's a comfortable limit. It could be 1, and I can tell you my PSA is 0.95. The last one I had about a year ago was about 0.93. So you can tell there's a gradual, very gradual increase in PSA, but still not alarming or anything to be worried about. Bernard, I think, oh, we lost you. Okay, so that is critical. Now,
no, it's not me, it's another Bernard as well.
Another Bernard, okay, I just let him in. Okay, so if you have a PSA reading of 5, 6, 7, then that may suggest you've got a problem that you need to get addressed immediately. So that is the critical thing. Any number above 4 or 3, if the range is 3, then that's the upper threshold, then you must seek intervention. Now, PSA test, you don't need a doctor to prescribe that. You can just go to any blood testing center and ask to do a PSA test, and they'll give it to you. They'll do that for you. It's literally pain-free. So if you notice that the PSA is elevated and you are having any of these urinary symptoms, then by all means, contact your GP immediately. What the GP or the doctor will do is, of course, arrange for you to have a biopsy. The biopsy is where they simply take some samples from the prostate gland and test for cancer. If it's low-grade cancer, that will be treated successfully. If it's a high-grade cancer, then it may mean a little bit more deeper intervention in that. There's so many things that they can do. If it's simply an enlarged prostate. There's so many medications there, which will either ease or relax the muscles of the urethra and the bladder to enable urine to flow freely. And these medications are easily available. They're not that expensive. So doctors can intervene very early to relieve this. And in certain cases, they can also give you medication that will start to shrink the prostate gland itself back to normal. And I know there's so many combination medications out there which they can do prescribe for you to start to shrink it. So it's never a situation where all is lost. And as the video said, you're never alone. It happens to quite a few of us. So nothing to fear. In extreme situations where the prostate gland has enlarged excessively, then there might be surgical intervention to try and remove some of the tissues that are actually blocking the urethra. So that is a more serious intervention. Or again, there's something called water vapor therapy, which they can use to try to again shrink the gland. The easiest is obviously the combination drug. And I know there's one called dutasteride or finasteride. And then there's also another thing called tamsulosin, which enables you to urinate more freely. But finasteride and dutasteride tend to be the hormonal drug that they tend to use to shrink it. And that's got phenomenal results as far as I know. So never be afraid to contact your doctor about any of these symptoms that you might have. So depending on the type of prostatic or prostate condition that you have, you may be prescribed one of these medications. If it's simply prostasia, then you have antibiotics to help kill the infection that's causing it. And sometimes there's stress management and counseling anxiety that can be associated with all of that. There are also common exercises, pelvic floor exercises. But again, my advice to you is always seek medical help first, because the condition itself needs to be diagnosed and the right treatment given to you at the right time. So the active surveillance. Now, this is a situation which is normally applied to those suffering prostate cancer itself. So if someone has prostate cancer, then very likely their PSA will be elevated. But there are known situations where the PSA may not necessarily elevate alarmingly for prostate cancer, and that the doctor might discover that through that digital examination. And in that case, the doctors might advise that you do the biopsies, and they come in. The outcome of that is either Gleason grade 1, 2, 3, 4, 5, 6, 7, etc. cancer that they might find from the findings. And depending on the grade, they might decide to do nothing but what we call active surveillance, where you may go in every 1 to 3 years to have it checked again because the cancer might be insignificant. And they say that most of those who get something like a Gleason grade 3 prostate cancer will not die of prostate cancer. They'll probably die of something else. So the doctors might just say, no, it's no point intervening at this stage. It's still far too young, and it's not aggressive, and it's not likely to affect you. But again, the doctors will make that particular decision. If they think it's an aggressive form of cancer, then there are several things they might do. One called this brachytherapy or focal therapy, and sometimes prostatectomy, which is where the prostate gland is removed entirely. If the prostate gland is removed entirely, then clearly there are certain effects that you would feel almost for the rest of your life, because that function is lost. So my advice is, again, getting help as early as possible. Don't let it get to that stage, because early detection is key with this particular situation. Now, annual PSAs, again, for anyone over 40, certainly encouraged. If you have a family history and you're younger than 40, by all means, start early, start doing the test. Regular exercising, eating a healthy diet, fruit and vegetables, always accounts for some good health benefits anyway. Smoking always contributes to whatever risk you have. You know that smoking causes cancer or promotes cancer, and therefore, if you're a smoker, then you're increasing your chances of getting prostate cancer as well. Now, there's some, what do you call it, health supplements on the market, which are very good. Saw palmetto has been known for prostate health, and you can pick this up from health food shops. Even if you don't have a prostate problem, it's something that you can use as a supplement. Lycopene, which is literally tomato extracts from tomatoes, are very good. Pumpkin seeds are very good. Zinc, and again, turmeric and vitamin D. I don't know much about stinging root nettle, but again, these are little supplements. Now, just remember, supplements will help keep the prostate gland healthy, but it does not necessarily mean you do not go in to see your health practitioner for the regular checkups and make sure there's nothing growing there that you do not want. Okay, so they say researchers have found that being physically active may reduce the risk. And I mentioned earlier the 30-minute walk every evening or more if you can. And of course, making sure that any symptom you've got there is properly diagnosed by a doctor. Make sure you stay away from over-the-counter medication to treat something that you don't really know. Get it diagnosed. Early treatment will certainly help reduce the effects. So don't delay it, visit a GP. Okay, mostly questions that people ask: can men recover from prostate cancer, especially if detected at an early stage and treated? Yes, it depends on the grade at which it's detected, but most people will recover. Some will recover fully, some will recover and might have a 5-year survival rate if it's an aggressive cancer, but 100% of men can make progress if it's detected earlier. And even so, when you've had surgery, it's a matter of just going in for the regular test and to check every 3 years whether there's any recurrence of the cancer. So the prognosis is good if you go in for early detection and you don't allow it to develop to an aggressive stage. So there is a lot of hope, and we need to take that. Now, post-treatment monitoring, very important. If you've been treated for prostate cancer, do not skip the monitoring. They say every 6 months for the first 5 years, followed by annual checkups. And again, this monitoring will be very useful to avoid anything happening in the near future. So living with prostate cancer, some men may live with prostate cancer for years. And I can tell you in confidence that my dad had a Gleason grade 3 prostate cancer detected when he was 73. He's now 88, and his PSA is about 3, which means that the medication, he didn't have any surgery, but medication that he took has been able to bring the PSA down to normal. So that is a living testimony, if I should say. And there are few people that I know who've had prostate cancer diagnosed, had medication or treatment, and frankly, have survived it. So it is not a death sentence. We just have to be mindful and aware that this thing exists. It causes discomfort. It causes so many problems, but we need to be visiting the doctor on a regular basis. Maintaining the healthy lifestyles I've talked about. And again, there is support out there for the females who have loved ones who are suffering from this kind of condition. So you know how to support them and encourage them for that matter. I think we talked about the fact that, yes, it is curable. You cannot stop the prostate from growing entirely as a man. It will grow, but you can shrink it with medication, and you can reduce the incidence of cancer by doing early checks, etc. So in summary, recovery from prostate cancer is possible, particularly with early detection and appropriate treatment and the regular follow-up. And if someone you know is facing prostate cancer, it is essential that you work closely with your health provider and make sure that they have a developed, personalized care plan that they follow. Okay, so there are so many campaigns out there. Check for cancer, and if you go on the website, you will see so many of these. There's information out there to keep you aware, and I hope you will be spreading the message going forward to your friends who are taking shortcuts because they're suffering from erectile dysfunction and are taking all sorts of medication. Encourage them to find out the root cause of that erectile dysfunction. May well be prostate enlargement, or it could be an early stage prostate cancer. So please go out there and tell them about it. So again, these are some of the campaigns that I'm aware of, and they spread, they share information. So again, if anybody is in doubt or wants to know more, then you can point them to any of these initiatives. The slides will be shared after this. So by all means, feel free to spread the word when you go. Okay, I'll ask you all to unmute and feel free to ask any question that you have at this stage. Any questions? No questions. Either you're all very concerned or you understood it all.
Yeah, just a small question
Yes.
from me. Thank you very much for the insightful presentation. I think we've learned a lot from the presentation. I just want to understand the age. I remember in my workplace, they were, I think last month, they were encouraging people to come for the test. But then
Yes.
they were very particular about some age group that when if you are not above, I think is it 40 or 39?
Yes. It's 40
Yeah,
and
40.
upwards.
Yeah. So some of us who are not yet there were a bit skeptical. So though
if you're boundary getting close to 40, but have a family history, then nothing stops you from walking in and asking for a PSA test. You can go and ask, go to what's called Lancet or any of these blood testing places and just check. The first one might come up as 0.5 or something. Then at least the following year when you check, you can see whether there's an increase. And then gradually you'll be able to notice the rate at which it's increasing. As I said, I checked mine. The first time I checked mine when I was in my 40s, it was about 0.65. I'm now in my 60s. Last year was about 0.95, sorry, 0.93. This year is 0.95. So it's a gradual increase in that over the years. What should be alarming is a steep increase from 1, and then next year you check is 1.6. The next year is 2.3. That is quite steep. So that will suggest some sort of alarming increase in the condition. I hope that helps, Ruji.
very well, very well.
Yeah, so it's good to have that initial test as a benchmark and then follow up every year and see whether there's been a positive or negative change, or the rate of change. Indeed, that's what matters. Any other questions, Bernard?
I'm here.
Any question at all?
We want our participants to, participate in this. This is an open forum, so there's no question which is right or wrong.
Please feel free to ask.
Yes.
If I can answer, I would answer. Okay, well, in the absence of any questions, I would thank you all for taking time to come and listen to this. And then hope that as you go, you also spread the word. Because that's the only way we can stop this thing from making us a very, very an important statistic, which is where Black men are very, very exposed to it, and Black men have a high mortality rate because we're not aware. Let's spread the word so we can change that statistic to a more pleasing statistic where we become more aware, and of course, don't die in the numbers that we are dying because of ignorance. So thank you all very much. Bernard, is there anything else you want to share group-wise, or give us an indication of the next meeting?
Yeah, exactly. So, like you rightly said, that they can walk in themselves to, some of the private laboratory that you mentioned, the Lancet. So I would say there may be somewhere in their location, there may not be Lancet, but some of the regional hospitals or the teaching hospitals or some of the even district level hospitals, they can also test your PSA for you. And it is not something that it is too expensive. So you can do that on your own volition.
Thank you for that contribution.
Yeah. What I want to add is that, so there are instances where they put rubber or tube for the aged.
The catheter.
The catheter, yes, for
yes.
To ease their urination. Is it due to the prostate cancer, or it is
yes?
They have the UTI itself, or maybe some.
It's most if the tube goes in, it's most likely because of the prostate enlargement, where the urethra is being squeezed or blocked. Because remember the diagram, the prostate surrounds the urethra. So when it becomes inflamed, then clearly it obstructs the flow of urine. So that's a situation where somebody is experiencing what we call urine retention. Yeah, it's most likely that situation, yes. Or if someone has had a bad infection or inflammation of the prostate, then again, the urine will be obstructed and that tube would go in. There are also times where people may have surgery, which is not necessarily connected at all to the prostate, but the fact that they're bedridden and cannot go out to do the normal peeing by themselves because they can't get out of bed, they might put something called a condom catheter over the penis, just so that they can simply urinate without getting out of bed. So there are different types. In that situation, clearly they've got nothing to do with the prostate. But if it's the prostate is obstructing the urethra, then the catheter will go straight through into the bladder, through the urethra. Yeah.
Okay.
Okay.
Madam Isi, we want one question from a female. Nana Isi.
AC, Nana AC.
Yes.
Yes.
Yes, please do feel free to ask a question. Do you know of anyone suffering from?
No, please, but
you don't.
The question I want to ask, I don't know if it is I don't know. I don't know if it's a myth or if it's a fact. but
Okay.
we have heard severally that I think the more the men
Ejaculate.
ejaculate, that is when they how will I say, they have a less chance of getting the prostate cancer. So I'm asking if that is true or that is false. What truth lies in any of those statements?
Yes, I know. I've heard that as well. They say 21 times a month.
Yes.
You've heard
So
that
we
too,
are
haven't you?
wondering.
Yes, I've
Yes.
heard 21 times a month. And if I had a girlfriend who I needed to be satisfied, I'll say, my friend, if you don't let me do it 21 times a month, this is what's going to happen to me. No.
True.
For your boyfriend's sake, I'd like to say yes, but there is some indication that if you don't have sexual intercourse for long periods of times, then you can have what we call fluid retention generally around the prostate area, and therefore that can cause infection, which may lead to it. But scientifically, I don't think they've proven the fact, but they do know that men who have regular exercise and regular sex, which is also a form of exercise, can avoid having, or indeed may put off prostate enlargement. I hope that helps. So there is some connection, albeit there is no scientific evidence to suggest that you've got to have 21 times, ejaculate 21 times a month. It is such a precise figure that it cannot apply to every person.
Thank you very much.
Yes,
for this education.
but the exercise helps. General exercise will help. I mentioned earlier, I don't know whether you were here when I was talking about the lifestyle and having regular exercises. So sexual intercourse itself is some form of exercise. So it helps.
Sorry, another question. You mentioned due to fluid retention, maybe the person can get an infection and that would
Yes.
degenerate into that. So I'm
Yes.
asking, is there any other way of
easing that?
Easing the fluid retention other than having sex? What about if the person cannot have sex because of a particular reason and has that fluid retention? How do we do we necessarily have to go to the hospital, or it's something that can be done at home? How do you solve that?
It's best to talk to a doctor.
A doctor
about
okay.
that. Yes, I would suggest you do that. If there's fluid retention because for some reason the person can't have sex, then yes, the medical practitioners will be the best people to advise that. And I don't want to put them out of business.
That's fine.
Yeah. But there's so many things that can also contribute. I mean, as I said, even usual sexual transmitted diseases can also cause prostate ailment, inflammation in that whole region. So it isn't so much about trying to have sex as often as possible, but it's more to do with identifying a discomfort or a dysfunction or an ailment and seeking medical advice early to get to the bottom of that through scientific test. Yeah, that's the key.
Okay.
Okay.
Thank you very much.
Thank you. Thank you. I'm glad we have a woman on board. Any other questions? Okay, well, thank you very much for your time. You've been a great audience. And by all means, if you think of any other questions, feel free. You'll be able to find me on the IRSM branch. You can side by me with a question or indeed contact me by phone. I'll be happy to assist. Okay, so I'd like to wish you all a very pleasant evening, and Bernard will circulate the slides to you later. Okay.
So before we go, let me put.
Should I stop sharing, Bernard? Yeah.
My number so that they can put their email address or their contact number so that we can share the slide for them. So please, I've shared my WhatsApp number or my
Yes,
email
I think
address. So yeah,
I can see those. So
okay,
Bernard, you've captured it, yes?
yeah,
Okay.
very well. So in the absence of any other matter, so our next meeting hopefully will be on the 4th.
The 4th of December.
4th December. 4th
Okay.
December 2025. Yeah, so we hope to meet again.
Okay.
But we would like our attendance to improve.
We'd like to see an increase, yes, in the
Exactly.
attendee level. Maybe the subject matter this time kept most of our women folk away, but it's been useful for them as if
exactly.
us,
So
yeah.
because they have fathers and uncles and friends
Yes.
and their own.
At some point, we'll try and tackle breast cancer awareness as well and all of the other ailments. So there will be an opportunity. Okay.
Yeah,
all right.
So we want one person to move the motion so that we can end the meeting. If in absence of vice, sorry.
Yes,
something?
I move for it to be.
Oh, okay. Okay. Amesi, will you second?
Yes, I second. Thank you.
Oh, okay. It's a wonderful night, and we appreciate your you coming as well. So hope to see you next time.
Sure.
Okay.
All right. Good night.
Good night, all.
Good night, all.
Bye.